Every year, cigarettes are picked up, lit up, and smoked. Smoking has been a mainstream addiction for over thousands of years, with around 6 million people dying each year from it, only 5 million of which are actual smokers. But how can we save them from such a fate? You ask, hopeful that we have an answer. As scientists, doctors, pharmacists, and people like you, we're trying our best to find solutions to save them from these nasty effects. And in doing so, we have discovered a few things that had to a degree.
I have been taking Chantix for about 2.5 months. For the last 2 months I haven't smoked any cigarette, but at first 2 weeks I only smoked 3 cigarettes, but after that I don't feel like I want to smoke. I feel fine. The pills made me stop smoking for a long time. The pharmacist advised me to take the pills after meals with a glass of water. He also advised me that if I tried to take any nicotinic treatment along with this drug, it would be useless, as this drug caused something called partial nicotinic receptor antagonist. I don't understand his chemistry, but he's a pharmacist and I trust him. He made an effort to make sure that I understand everything I take.
But not everything is as simple and admirable as this. Most other drugs don't really work with most simply feeding nicotine to the patient at a higher cost than actual smoking, which leads to a higher rate of relapse into this fatal habit. Some other drugs do even worse, leading to patients to suffer from extremely terrible side effects.
I've been smoking 8 years now. I started smoking when I was very young, just because all my friends were doing it. At time, I would feel happy, but within no time, I would feel extremely sad or uncomfortable. When I got older, I realized how terrible it was to my health. I couldn't live like this anymore. So I tried to help myself. I really did. I go to a doctor and asked him to give me a medicine to help me or to enable me quit this terrible habit. He gave me a medicine which is called Popropion, I think. He told me that I should take this medicine like any other medicine. So I go on it for 3 weeks. Taking 3 pills per day, but after a time I realized no changes. I didn't feel like I want to stop smoking, but I insist on taking it to help with it. After 2 weeks, and I told to myself that it's just a matter of time and it will work well. After 2 weeks, I feel myself depressed, but I told myself that the drug stopped the effect of nicotine that makes me happy. So this is the reason why I feel depressed. After 2 weeks, I feel that I cannot get out of the bed. I even cannot do anything. The drug makes me, I want to kill myself.
Some cases are not as extreme as this, while others are much worse. The drugs we make today to treat our brothers, sisters, mothers, and fathers are in need of serious advances. We need medicines that will not cause depression. We need drugs that will not cause the patient to commit suicide. We need drugs that work, if not for the scientific goal of medical discovery, then for the humanitarian goal of saving lives. Remember, as pharmacists and doctors, it's our job that the patient is completely aware of how the drug works, its usage, and any negative side effects you are aware they will cause. You might save someone's life.